it's been such an interesting road we have traveled. I was very fortunate. I had a company for 25 years, employee benefit consulting firm for 25 years, since 1988. And one thing led to another. Big consulting firms in the last 4 or 5 years were anxious to buy companies like mine, and unbeknownst to me. And then last summer, I went through that process and got convinced it was going to be a good idea. And honestly, even last summer, last summer was not that long ago. Was it last summer? This is 13, 12. Was it last summer that I did it? No. Summer a year ago, sorry. I've already been with them a year now. So Obamacare had already, that was already in the works, right? It's already been voted in. And I went through my process with these other 3 large companies that, wanted to buy us and merge with us. And I'm really amazed to think that through that 6-month process, this was well after Obamacare was, put in. Not one of those companies mentioned Obama. Not one at any of the negotiations or any of the processes did they mention it. Did I even think about it? And because I think at that point in time we were all thinking that Obama wasn't going to get reelected, or that was secondary to that the Supreme Court was going to strike it down. So it's been interesting. So that is significant because those 2 things, delayed implementation or delayed knowledge. See, the readiness of PPACA or the government right now, the readiness of PPACA or the government to implement PPACA is way behind. And mostly because of the things that I just got through mentioning. So it wasn't until January, the law was there. Very few people had read it. This big, 17,000 page deal. Very few people had read it. Most Congress voted for it without reading it. You all knew that. Well, after the Supreme Court, after Obama got reelected, they could start telling us what it means and then giving us regulations to follow. And those are coming out about every week now. So, I thank God that I'm with a large organization with a bunch of ERISA attorneys that are disseminating all that information. So every Monday I get these updates to it. So it helps us to understand what we need to get our clients ready for, what the timelines are. And it's been very helpful. So the problem with PPACA now, though, is the confusion in the marketplace. And here I'm the consultant in this space, and I will have to say that we're probably, we're say 100% ready for what they've shared with us through regulations. But there's still about 50-60% to go. So they've already admitted that they weren't going to be ready for a big piece of it, which was the exchanges for companies under 50 lives. So those aren't going to be ready for January 1st. So they're moving those off to a year. And when I heard that, I started thinking, and this is speculation, that other parts of it might be coming, or might be getting delayed as well. Now, again, nothing official about that, or at least the penalty phase of PPACA there's talk up there that there's penalty phase might get delayed. So we'll see. So I thought what I would do today is just start off with some interesting discussion points. There was an article that came out in Time magazine a few weeks back, maybe a month ago, called The Bitter Pill. Did anybody, if you have to be in this business to kind of even read it, to want to read it, but did you read it through?
Most of it.
Did it generate some, emotion in you?
Yeah, I mean, it's the sort of stuff you've heard before. I mean,
yeah.
Just around, like, in a news story or going to your doctor, but then to see it all in one place, kind of put together.
What's been insured? What's been shocking to you or noticeable to you when you get your bill from your healthcare provider, your professional, and then the insurance company pays your professional? What do you generally notice about that? Anybody? Yep.
The difference between what what is charged and what is paid.
Yeah.
But what is charged can be whatever the bank matches, doesn't
Yeah.
matter.
The charges appear to be arbitrary, somewhat arbitrary. Now, it varies with the product. I'm holding this, but based on that article, I'm gonna give you some examples. I bought this pad, this box of gauges, I'm saying that correctly, gauges today, at CVS Pharmacy. And I think I paid $3 for these. And in this article, it noted that this guy took about 4 different couples, and they were patients in particular hospitals, one in Houston and I think another one in Maryland and somewhere else. And successful hospitals, very successful hospitals. And he took the SIC codes from their bills. One was $48,000, and that was the testing that this person was going to go through, and then to decide what type of care they were going to be given. So it was $48,000. So that's that arbitrary number. They were uninsured. So his mother was going to stroke the check to pay for the $48,000. And the guy this author of this article took every single line item and drilled down and found out where did the cost, what was the cost, what was the generated cost, and who got the money, and that kind of thing. Well, there's so many examples, and I pulled it up and I thought I maybe share some of them, but this, I want to go, does anybody have any guess what this cost me $3, I guess, today? If I bought 2 boxes, but I didn't want to do, it would have cost me about $50, because you buy one, you get one free. So I just bought one. Well, no, buy one and you get the other one at 50% off. So anybody there was 4 of these boxes used on that guy's bill. So anybody want to hazard a guess
Guess what?
of what the hospitals, thank you, what was the hospital charging?
$50.
Maybe $200.
Close. $78. So there were 4 boxes times 78, and that's what the charge for just those gosh. He went over and over and over again some other examples.
From the article,
Yeah.
I mean, it was like I don't know, probably 5 or 10 examples that were just like that from across the country.
Yeah.
It's pretty amazing.
Yeah,
Like
it
the
is.
stuff you can buy at CVS.
But was this cherry picked?
No.
From what?
If you didn't say this was representative, then it was cherry picked.
That was the
Well,
impression.
here's another example I'll say.
That was the impression.
The
is
test
that it
strips.
was
Test
common.
strips. The patient was charged $18 for each test strip. And they're called AccuCheck diabetic test strips. They're sold for $50. A box of 50 are sold for about $27 or 55 cents each, and the patient was charged $18 per. There was another thing that's interesting. The SIC code. Then you have these hidden codes, and I won't even read it to you, but here is something was billed for $8,000, $7,997.54. That's a stress test using radioactive dye that is tracked by an X-ray. You probably have done those. You probably know those. You probably order those. This won't be offensive to you, I'm sure. But X-ray computed tomography and a CT scan. Medicare pays $554 for that test. So this is a significant portion. This is not addressed in PPACA, what we're talking about right now. But this is starting to generate strong interest. There's a thing called the charge master in hospitals. The charge master I've known about, that is what, if you're going to receive money from Medicare in your hospital, that's a pricing list that supposedly cost of the 2,000 to 3,000 SIC codes that hospitals generate and bill Medicare for. And I'm sure they struggle every year to update it, to figure out what it is they're going to charge and what is their cost associated for these items. And then the insurance companies and the Medicare will reimburse about 10 to 15% in addition to that. So they'll give them 10 or 15% profit to that, okay, to their cost. They require it, the government requires it, so they have all this data from all these hospitals that receive money from the government because they're the largest purchaser of healthcare.
When you say cost, does that mean
Pure cost.
Cost of goods sold, or does that include labor, et cetera, et cetera.
It includes labor. And it's all submitted by the hospitals. It's their data to the government, and then the government says, okay, we're going to pay that plus 15%, or that plus 20%. And then there's a retail cost for that that's over here, that in theory few people pay. And then the healthcare community, the United Healthcare, Aetna's, and everybody, they come in to negotiate with Baylor, for example, and then they will brag that they have a 50% discount off of this number over here. But in general, they're paying about 30% more than, say, Medicare. So this lack of transparency is, I think, a good point, is starting to be addressed, and it's just starting to be addressed. And I thought that might be helpful for you all to know that now. I think it's not part of the bill, but it's because of this bill. And I think another interesting thing that I read this morning was is Sibelius, I think is her name. So she is the head of health and human resources right now. Okay. And apparently, I didn't know this, but she is out asking for donations to help fund PPACA or help fund Obamacare, because Congress is, stymied and they're holding money back for it. So she's asking for donations. So where do you think she's going for those donations?
Insurance company.
Yeah. And the article is pointing out that the committees has sent letters to a dozen healthcare companies asking, meanwhile the Republicans will see. But the problem is that Health and Human Resources, they're making judgment calls on what these insurance companies are going to be getting. And so they feel like there's a conflict of interest for her to be asking them to give money. And so I think that's kind of interesting. That's been happening.
Mark, the other aspect of that study, if I remember correctly, there was he also takes different hospitals and kind of treating a heart attack was treated for about $3,500 in a city in Arkansas with similar treatment in Pennsylvania, which was $95,000 or something.
Right.
And then he said, okay, maybe that's a state-to-state separation,
Yes.
but if we just took New Jersey, and I think he checked out how a pacemaker installed in New Jersey in 2 different hospitals,
Yes.
70,000 versus 110,000. And
Right.
so these kind of disparities.
We don't have, there's nowhere, if you're shopping for a Mercedes, none of us here would, but I know Mahesh would be shopping. So when Mahesh goes to shop for a Mercedes, he can check all over the country within 15 minutes about that price, so he's ready. What else do we buy that we're not really ready to shop for? So I believe that this is all part of the consumer awareness part of this is, I think, going to be more helpful than PPACA. Here's another thing. Sorry that I can't document this. I can't document it just because I didn't write down the documentation, not because I'm hiding it from you. But it was a little sad. Now, there's all kinds of other people who are saying, we've done this study and PPACA is going to cost $1 billion and $1 trillion more and who knows what. But here's what was, I understood why they came out with this one. All right, there are about 45 million Americans that don't have health insurance. There's about 25 million that just say, 20 million, that have the opportunity to get it but choose not to. I know in my own business, we've had it for 25 years. For 25 years, if an employer says you need to pay $10, $20, $30, and you have the opportunity to decline it, I know with the lower paid people, generally speaking, if you're going to charge them something, at some point they just say no, and they'll go uninsured. And that's been part of my practice for years and years. So there are people that have opportunity to get it, but they choose not to pay for it.